The guest is Dr. Cupid Poe, and we're talking about the World Conference on Against Racism in South Africa. And of course, Dr. Poe, before we had our first commercial break, we promised that we'd give you an opportunity to talk about some of those issues associated with racism, but perhaps some issues that folks don't ordinarily associate or tie in to racism. And so let's give you free rein to talk about some of those issues now.
Well, as I said, poverty is widespread among South African blacks. And we know that up until 1994, South Africa had an official policy of racial separation, an official policy of legalized racism. And so it's very obvious that the oppression that went on, the educational oppression, the political, the social oppression, has greatly contributed to the level of poverty in South Africa. Now, poverty doesn't stop there. Poverty also leads to some other problems. One, crime. South Africa has a crime problem in almost every city we went into. We were cautioned, be careful, don't go here alone, don't go there alone, because we've got a crime problem. The crime problem affects blacks, as well as Indians, as well as coloreds, as well as whites. As a matter of fact, I feel that there was more paranoia, as you might understand, as you might expect, among the whites relative to the crime than there was among the other groups. But there was anxiety among all groups that I talked to. Not only does racism generate poverty, and also it generates crime through generating poverty, but it also generates sexual promiscuity because oftentimes unemployment is a consequence of racism. Okay, now here you've got a man and a woman, for example. Let's say a man who can't find a job. Okay, he's unemployed, and when he is employed, he's treated as if he's inferior. Now, what can you expect that man to do? He's frustrated, he's angry, and most likely he's going to seek some kind of outlet, okay, in a way that's available to him. So racism then contributes to sexual promiscuity. And we know then that HIV/AIDS is related to sexual promiscuity. Racism also contributes to alcohol and drug abuse. If a man is idle and he is frustrated, can't find work, it just increases the probability of sexual promiscuity as well as drug and alcohol abuse. And so that then increases the probability of HIV/AIDS. And so in South Africa, you've got a high level of poverty, a high prevalence of poverty. You've got a high prevalence of unemployment. I was told approaching 50%. You've got a high level of, a high prevalence of crime. You also have, I believe, a high prevalence of sexual promiscuity and therefore a high prevalence of HIV/AIDS. And so all of these are related and very much then racism generated. Now I won't say it's totally racism generated, but in South Africa we have better evidence than in other communities that apartheid racism was a major contributing factor to these problems.
You know, this issue of HIV and AIDS, I think Africa, the continent, is leading the world in terms of cases. Now, let's talk about, what did you see there that indicated that this was a problem? Did you see any evidence of, I mean, did they make any tours or anything to demonstrate to members of the various delegations of this being a problem?
Well, I don't know about the delegations, but I had the fortunate experience of visiting a school, the William Gray Gardens School, a home. There were 200 children there from birth to about age 18. 60 of those kids, well, 60 of those were children between under the age of 7. 40% of that 60 were HIV positive. I saw, I met about 2 or 3 kids. There were 3 kids who were from about 2 or 3 years of age who were dying of AIDS. I also met some other kids who were HIV positive. I visited an adjacent part of that school, which was a hospice for children. And since a year and a half, 19 children now, between age 2 and 7, had died of HIV/AIDS. Now that's the reality, that's part of the reality. The other reality comes through when you talk to people, and I did, who said, you know, I have a sister that died of AIDS this year. I had a brother that died of AIDS this year. One of the doctors in South Africa, Indian doctor, allowed me to see 2 of his patients, okay? And so one of the gentlemen I talked to was HIV positive. He was a truck driver. His wife was HIV positive. His 18-year-old son was HIV positive. AIDS is a very real, it's a real concern. I mean, it's a reality for many, many South African blacks.
Well, now, what are they doing in terms of, I know in this country we say that the best method to combat this disease is education, education, and education. What are they doing in South? Is there any kind of government recognition of this as an issue or as a problem, and an attempt to try to solve it as a problem? Or what are they really doing to meet this as an issue?
Well, I have to acknowledge, I don't know what the government is doing. The medical community is aware of the prevalence of the problem. One of the doctors who works in Durban's health clinic indicated that about 33% of the patients that he sees are HIV positive. And that's a very, very high percentage. Now, we didn't go into the availability of medication. You recall a while back, there was some problem in getting anti-AIDS drugs to some of the people in Africa who were HIV positive. But I understand that the barriers to that was kind of clear to some extent. So I can't comment on treatment. I do know, unfortunately, there's a lot of delusional thinking on the part of some people. It is said that some males believe or have the delusion that if you're HIV positive and if you have sex with a virgin, then it'll clear it up. So you have that kind of misinformation. So I don't know what's being done. My impression is not nearly enough. I don't know how many the drug availability to fight AIDS in South Africa, but I think not nearly enough.
Now, what about the United Nations? I mean, does the United Nations respond to this as an issue, or what is it doing in reference to this?
Well, my understanding is that they are collecting money. They are attempting to invite donations, but they are not pleased with the amount of donation, the amount of donated money. But the United Nations is aware of the problem, and they are making some effort to address the problem.
And it is an international problem.
Oh, yes.
This whole issue of AIDS.
Yes.
And while we might not experience it as severe here, among all Americans, that it also impacts a large number of Americans here. Is that what we're seeing?
Oh, yes, very much so. Very much. AIDS is a very real problem in America, not only among blacks, but among whites as well.
And it's a problem that's not going away.
No, it's not going to go away.
And of course, let us have this next commercial break. Dr. Poe, and we'll be back following this short commercial break. The topic is the World Conference